Hi, welcome to lesson 133 for 6th grade health. Your homework for this lesson is to reread pages 32 to 36, do CCU 2, B numbers 1 through 4, E numbers 1 and 2, and F numbers 1 through 7 on paper. So we are looking at pages 32 to 36 today, and so you can go ahead and get that out. Last time we were talking about exercises and how you can best avoid injuries while you're exercising. So warming up slowly, cooling down slowly, jogging or walking in order to avoid muscle soreness, muscle strain or sprain. And what is the method that helps with sprains and strains if you get them? It's an acronym, it's one word that means 4 different other words. I've given you enough clues. So it's RICE, rest, ice, compression, and elevation. And so you want to do that if you have an injury to a muscle. Now, a fracture is defined as a break, chip, or crack in a bone. And so this could be caused by a motor vehicle accident, a fall, or being involved in a recreational or a sporting event. And so you want to take care if you are part of any of those things, take care not to prevent some things. Now, I understand that there's not a way to prevent everything, but there is ways that we can be more careful. There's a simple fracture that's called a closed fracture, and a compound, which is also which is called an open fracture. So our simple fracture means that it doesn't break the skin, but a compound fracture means that the bone does come out of the skin, and so those can be pretty gruesome. It's going to have there will be blood with that, and it's not very pretty at all. I have had 2 fractures, 2 broken bones, but both of them were simple. Neither of them came out of the skin, and so I'm thankful for that I did not have to deal with that. But if you have come upon someone that you think may have broken a bone, or you yourself you think has broken a bone, pardon me, there are some ways to check. So if it's a compound fracture, that's an obvious way you can see that it has come through. If it is just a simple fracture, it is harder to detect. But if you are not sure if it's a sprain or a fracture, you should treat it like a fracture, which means that you shouldn't put any weight on it or use it for anything. So if it's an arm, you shouldn't be lifting anything. You shouldn't be putting your weight on it to get up off the ground or anything like that. And so you need to have the proper diagnosis. And so sometimes you may have to just guess. And so you want to guess for something that's more serious than what it actually is. If you are maybe out in the wilderness and you're camping or something and you're not sure exactly, go with the more serious injury, because if you protect it for a more serious injury and it's not quite so serious, you're going to be better off than if you'd gone for the less serious injury and then you end up injuring yourself even more or someone else. A split can be applied. It's just support, really. So you can have boards or sticks. If it's a leg or an arm, you can use it for an arm too. Just something that's straight, that you have 2 pieces of, that you can tie with cloth or bandanas or something that can hold it in place. And it really just supports that area so that you don't use it and that you don't injure it further. If you have a dislocation, that is where a bone is out of place. And so things like a shoulder, because this is a ball and socket joint. So if you remember that from previous health years, and we probably see some of that in this year as well, but the ball and socket, the ball can come out of the socket. It's not pleasant at all. And if it's not treated properly, then it can happen frequently to someone who has had a dislocation. And so there are some people that they do have bones that come out of joint because it wasn't treated properly when it did come out the first time. And then you do have skin deep irritations, cuts and abrasions. And so this would be just your typical cuts that we get cuts all the time. If you get a paper cut, or if you get you're walking and you get caught on a tree limb or something. So just that this gives a couple different types of injuries, or a couple different scenarios where they're all the same injury. Trevor's arm brushes an exposed nail while exploring an old barn. Justin slides into home plate to tie the score of the baseball game, and Morgan turns a sharp corner and falls off her bike. All of these activities are different, yet all three young people probably received the same kind of injury, a cut or an abrasion. So the cut is like an incision, a wound that is a break in the skin. Okay, that's all that term means. If it's deep enough, it may require stitches in order to heal properly. If it's just a scrape, it's probably just going to require a Band-Aid. You do want to make sure that you wash any cut with warm water and soap, because then you don't want any dirt or anything left in there that could cause an infection. Because if something gets infected, you're going to see this yellow pus, yellowish white pus. And if you have that, it means it's infected. And if it's infected, you should go to the doctor. So you want to avoid having an infection by cleaning it properly. An abrasion is similar, but this is more of like if you've had a rug burn or a road rash. An abrasion just is when the outer layer of skin, the epidermis, scrapes against a hard surface such as concrete. Sometimes a rug burn can do the same thing. It's maybe not quite as hard as the concrete, but it can do a similar thing. When you fall, we normally fall on our knees, our elbows, our hands. So those are most likely to get scraped. And so you also want to wash those with warm water and soap to make sure, especially if you fall on the gravel, the asphalt, concrete, you want to make sure that you get all those pieces of dirt and rock, tiny rock, out of that cut. You don't want anything left in there. The nosebleed would be the last thing that we're going to look at, and just to make sure that you know, pardon me, that if you get a nosebleed due to getting hit by something, like playing sports and you get hit in the nose, or somebody accidentally hits you in the face or in the nose with their arm. It's not very pleasant, but if that happens, then you want to do a couple things. So you want to actually sit down and get a cold cloth, cold paper towel, and you want to sit and put your head slightly forward to avoid the blood coming down your throat, okay? And so when you do that, you apply the cold wet paper towels so that it reduces the swelling so that it can heal. And then you want that nosebleed to stop. So within 15 to 30 minutes, if that has not stopped and it continues, you may be looking at a broken nose. And so you do want to get that checked out if the bleeding doesn't stop. But sometimes there's other things that you can have that you might get a nosebleed, like if you go hiking up in the mountains, the high blood, um, the high altitudes may cause your nose to bleed. And if you were to blow your nose too hard, you can also cause it to bleed. So just be careful of those things. And you could normally treat those yourself, but just watch out for the times when it might be more serious and you do need to consult a doctor about that. All right, and we will talk with you next time.